Hello, I am Alex Tarpley, and today I will be presenting my final project for health and wellness education. My objectives are to learn about the definitions of public health education, health promotion, and health prevention. Also, to learn about the 7 health education competencies, an example of a health education program and their mission and their focus, why that particular health education program interested me, what aspects of health education I understand better now, and lastly, my career goal and how I plan on implementing these health education aspects into my career. So to begin, what is public health? According to the American Public Health Association, public health supports and protects people's well-being and the neighborhoods where they live, study, work, and play. So for those that work in public health, it is their job to make sure that people do not get sick and to promote the overall wellness through supporting healthy behaviors. And while in the field of public health, people should work to make sure that every person is healthy and that the condition they live in are also healthy. And so this includes vaccinating children and adults in order to prevent the spread of a disease or teaching people about the risk of smoking and alcohol. Public health also sets safety requirements to protect staff, and school nutrition services are designed to ensure children have access to nutritious food. So what is health education? Health education is a multidimensional term that encompasses skills from a variety of disciplines. And so according to the World Health Organization, health education is any mix of learning opportunities intended to help individuals and societies improve their health, either by increasing their awareness or affecting their attitudes. What is health promotion? Health promotion is a process of enabling people to increase control over and to improve their health according to the World Health Organization. It also covers a wide range of social and environmental interventions that are designed to benefit and protect individual people's health and quality of life by addressing and preventing the root causes of ill health, not just focusing on treatment and cure. And when it comes to health promotion, there are 3 key elements. The first one is good governance of health, which requires policymakers across all government departments to make health a central line of government policy. Second is health literacy, which requires people to acquire the knowledge, skills, and information to make healthy choices. And the third one is healthy cities. So cities should create strong leaderships and commitments in order to support primary health facilities. So what is health prevention? Prevention is not just preventing a disease. It means practicing those beneficial healthy behaviors. That prevention should include actions and interventions designed to identify risk and reduce susceptibility or exposure to health threats before the onset of a disease. That prevention refers to actions aimed at avoiding the manifestation of a disease. So this includes actions to improve health through changing the impact of social and economic determinants on health, the prohibition of information on behavior and medical health risk, alongside consultation and measures to decrease them at the personal and community level, nutritional and food supplementation, oral and dental hygiene education, and clinical preventative services such as immunization and vaccination of children, adults, and the elderly, as well as vaccination for people exposed to a communicable disease. And so the 7 health education competencies are: assess the needs, the assets, and the capacity for health education, plan health education, implement health education, conduct evaluation and research related to health education, administer and manage health education, serve as a health education research person, and lastly, communicate and advocate for health and health education. So area of responsibility 1 is assess needs, assets, and capacity for health education. And the way I implement this responsibility is by going out into my community and assessing their needs. So for instance, since I am wanting to work with children and adolescents, I can go into their community and see what type of resources they need or they're lacking of. I can then create a program based on my research of my community and infer these needs into my health education program. Area of responsibility 2 is planned health education. And the way I can implement this responsibility is through my work with children and adolescents by creating goals and objectives for them to complete during the program. I can also design the types of strategies they should have to do in order to tackle their issues and problems. One other thing I can do is create activities that they can do while in the program with their peers. Area of responsibility 3 is implement health education. The way I can implement this responsibility is by creating a plan of action for the program. I can then train people to implement the plan of action. Lastly, I can make sure that these implementations are working for my program through doing an anonymous survey. Area of responsibility 4 is conduct evaluation and research related to health education. The way I can implement this responsibility is by creating a plan that evaluates my program. I can also create surveys for my clients to fill out about the program so that we can use it to research how effective the program is. I can also use these research data to fix the program so that we are able to fully help these people. Area of responsibility 5 is administer and manage health education. The way I can implement this responsibility is through managing my resources and making sure that my clients are getting the right type of help. I can also allow clients who have completed the program in the past to come back and talk about their experiences to these new clients. I can also demonstrate leadership through advocating for my program and making sure that my staff members are demonstrating the same amount of leadership. Area of responsibility 6 is serve as a health education resource person. And the way I can implement this responsibility is by providing training to those that are interested in working alongside me in my program. I can then obtain health-related information through my community and the resources that I use for my clients. So for instance, I can ask the children and adolescents that I'll be working with if they want to be trained and what types of resources they are wanting and are needing or lacking. And then lastly, area responsibility 7 is communicate and advocate for health and health education. And the way I can implement these responsibilities is by advocating for the needs of the children and adolescents that will be going through the process of my program. I can also spread my message about my health education program to various schools in my community. So for instance, I can create presentations that I can present at these different schools that talks about my program and the benefits of completing it. Another way I can implement this responsibility is through developing a variety of communication methods. So for example, I can create an anonymous phone line that children and adolescents can call if they are in need of any help. So the type of health program that I researched was a sexual health education created by the Centers for Disease Control and Prevention, or the CDC. And so according to the Centers for Disease Control and Prevention, establishing a program that focuses on preventing HIV, STDs, and unattended pregnancy has been shown to lower an adolescent's chance of becoming sexually active. It also provides students with the knowledge and skills in order to help them become healthier and avoid HIV, STD, and unattended pregnancies. And it has been shown that only 43% of high schools and only 18% of middle schools teach these key CDC topics for sexual health education. And so their mission is to help prevent HIV, STDs, and unintended pregnancies among adolescents. They also want to provide quality health education systems that connect students to health services and safer and more supportive school environments. They also want to address the health needs of all types of students, including the needs of LGBTQ students. They also want to connect students to sexual health and other health services at school and in the community, engage parents, families, and community partners in school programs, and foster positive relationships between adolescents and adults. Their main focus is preventing HIV, STDs, and unintended pregnancies in adolescents. And through participating in this type of program, it's been shown to delay initiation of sexual intercourse, lower the number of sexual partners, lower the number of unprotected sex, increase the youth protection, specifically condoms, and improve students' academic performance. And that sexual health education can also be changed to target information on high-risk substance abuse, suicide prevention, and teach students how to keep from committing or becoming a victim of violence. So why does this health program interest me? It interests me because I believe that it is important that we promote the sexual health of adolescents, that we should teach adolescents about being sexually active and the effects of it, that they should know what resources are out there for them if they're deciding on becoming sexually active. Another reason is because I was surprised to learn that there are not a lot of health programs out there that teach sex education to adolescents, that according to Planned Parenthood website, only 24 states mandate sex education while only 34 states mandate HIV education. And so the aspects of health education I understand now. When it comes to health education, I feel like I have a better understanding of what it is and the various aspects of it. So, for instance, one aspect of health education that I believe I have a better understanding of is sex education. That after watching Dr. Purvis's lecture on sexuality education, I was able to learn just how important it is for us to know exactly what sex is and how to teach it. And that I was also surprised to learn that only 15% of Americans support abstinence-only education. Another aspect of health education that I now have a better understanding of is health program planning. That when it comes to planning a health program, it's essential that we create a program that assesses the needs of the population, identifies the problem, develops goals and objectives, creates an intervention, implements that intervention, and evaluates the program's results. My career goal. My career goal is to become a social worker that works with adolescents in foster care. That I want to be able to advocate for adolescents who are in foster care and that are in need of a loving family. I also want to work with their families and get them the help that they need in order to bring their children out of foster care. So how do I plan on using these aspects in the future? One way that I will use these various aspects in my future careers is by making sure that my career will allow me to promote for the overall health of my clients. That as a future social worker, it is important that I advocate for the rights of my clients and that I also promote a healthy life for them. And that also as a social worker, it'll be my job to make sure that my clients are able to provide for themselves and their families through the resources that I provided for them. Another way I will implement these aspects into my career as a social worker is by creating programs that target the health of adolescent foster children. That I will work with these adolescents to make sure that they are able to get the help that they need while they are in foster care. Lastly, these are my references. And so I'm hoping that after watching my presentation that you have been able to learn about health education, the 7 health education competencies and what they are, the type of health education programs, and lastly, how important it is that we promote health education and how we could implement health education into our careers.